everyone, it's Kristen. It's been a really long time since I've seen you. I think it's been about, 6 years now since my Nuss procedure and about 3 years since my bar removal procedure. And I just wanted to pop on and say hi and give an update. And I also wanted to just apologize to everyone who sent me messages and comments. I don't have the time anymore to go on those boards and on the messages and respond to everybody, but I just want you to know that I do see them. I still read them and they still mean a lot to me. So I really appreciate all of the kind words and everything that you guys have said over these 6 years, and it just really touches me. And this is something that was very therapeutic for me, and so I'm very happy that my journey and my therapy could help some of you. I think right now we're up to about roughly 1,100 people in our female pectus group on Facebook, which is wonderful. And I get requests daily that I'm still filtering through, trying to make sure that it's only females and that everyone's respectful. So happy to see that everyone is still using that and getting some good information. But the reason I wanted to update you is I had a major life event and I wanted to just fill you in on what it was like physically. So on February 19th, 2020, I became a mom for the first time. And beautiful little girl, her name is Penelope. She was 7 pounds, 5 ounces. And I just wanted to touch base on what it was like having been a pectus survivor. So for the actual pregnancy, I didn't really feel much of a difference having anything to do with my pectus. So yes, I've had the surgery and I've had it fixed. However, I still have only 70% lung capacity, which will never change. So obviously when you're pregnant, you get out of breath a lot, and definitely that happened. I think that maybe I was out of breath a little bit more than the average pregnant woman, just due to that decreased lung capacity, but it wasn't really too bad, nothing to stress out about or to make a huge difference. So I think for the most part that there was no difference of a regular pregnant lady and me having had the pectus surgery. Birth, however, was a different story. I did carry her full term and I gave birth, I think I was 40 weeks and 2 days when she was born. And I did deliver vaginally, and I will say, obviously this was my first time having no idea what to expect. The pushing was very difficult. A lot of it was due to my decreased lung capacity, so I actually had to get on oxygen by request. It was my request. So what I would do is I would put the oxygen on and then I would take it off and push for, your 10 seconds. And then when I'm breaking, waiting for the next contraction, I would put the oxygen back on, and then I would push and push and push, and then the oxygen. So you get the drift. But so I did have to use oxygen only because I had a hard time filling my lungs all the way in order to last those 10 full seconds with each push. In those 10 seconds, if you haven't done it before, they feel like an entire minute. So that happened. And then with the pushing, you obviously are just pushing as hard as you can. And so I did feel a lot of pressure in my rib cage area because of when you're pushing, you're bearing down as well. So it's kind of like a crunch type of movement. And that was really difficult. I could do it, and I did it, but it was not easy. It was pretty painful. And after, let's see, my active push time was 2 hours. I was in labor for about 24 hours. Active push time, 2 hours. But by the, I got her out and very, very, very sore in like this area right here. Very sore. I am now currently about 7 weeks postpartum, and the only thing I've really noticed, I've been watching carefully, looking at my chest to make sure that I don't have the regression or anything. I don't see anything yet, so hopefully nothing affected that. I would hate to have that surgery over again. But I do have a lot of pain in my ribs, and it's like my rib flare area. And it's not excruciating, it's just soreness. And so I think my body is just maybe adjusting and getting back to pre-pregnancy. I don't know. So breathing wise, I'm fine. Indent wise, I'm fine. It's just the rib flare is a little sore. And so that's what I've noticed, and I just wanted to share that with everybody. And of course, I'm not a doctor, and this is my own personal experience, and I'm not here to tell you what it's going to be like for you. This is just my journey. So take that with a grain of salt. But anything else, let's see. So the pediatrician, when we took her to her first appointment, I actually forgot to tell her on the first appointment. The second appointment, which was that same week, I did ask her, I mentioned that I had the pectus excavatum, and thankfully she knew exactly what that was, which was comforting, because I don't think still that every doctor does, and actually, in fact, I know that they don't. Several people I've discussed with, they want to know my medical history, and I say pectus excavatum, and they say, what the heck is that? And I have to explain. So I was happy to hear when I said pectus excavatum, she knew exactly what that was and said, I don't see that in her yet. So obviously that's something I'm going to have to watch with Miss Penelope, just in case it's, hereditary, and if I can at least catch it soon, then she can have that surgery a lot sooner than I did. I had mine at age 27 and the removal at age 31. Obviously, you're supposed to have it done in puberty, so I can at least just keep an eye on that, and at least the pediatrician can too. And then also breastfeeding. So that, oh my gosh, let me just tell you, that is the hardest thing I've ever had to do, ever. And also, I will say, giving birth, for me, it was hard. There were a lot of things that happened. I had complications. I still was able to deliver vaginally, but I had complications before, during, and after. The epidural did not work. So I felt literally every single little tiny thing, and I will say it was the most painful experience of my entire life. And if you've watched my other videos, you know that I'm pretty tough, pretty strong. And when I had my pectus surgery, it really wasn't that big of a deal for me pain-wise, and other people couldn't understand that, and I was just lucky because I'm pretty tough. But giving birth, what I went through, I don't wish that on anybody, and I still to this day can relive it over and over in my mind, and I would rather have that pectus surgery 15 times over than my birth experience, which is sad, but that's how it is. But the breastfeeding, my goodness, that was equally as tough. So the very beginning, if you've never breastfed, you'll have no idea what I'm talking about. You can imagine what it might be like, but you really have no idea till you try it. That's a huge challenge in itself, and I finally, 7 weeks postpartum, feel like I conquered it, and I'm in a groove. It's still, my supply is still not where I would like it to be, but it's good enough for right now. But I was really concerned that I wasn't even going to be able to breastfeed or produce milk. due to all of that surgery that I've had in my chest. If you've, like I said, if you followed me in the past, you know, but with the pectus surgery, I had 2 bars implanted, but I also had implants prior to that surgery, so we did an implant swap at the same time through the same incisions. And then when I had the removal, nothing was affected implant-wise, so we kept the same ones in. But I have a lot of numbness in my chest area that I've always had now, all of these years later, and it's nerve damage. And so it's, by this point, my feeling isn't coming back. So I was afraid that with all that nerve damage, it would have maybe damaged some of the nerves or the ducts or any of that inner workings that deal with milk supply and breastfeeding. And so I was really worried about that because it's something I've always wanted to do, is to try to breastfeed when I have kids. Not that I still believe fed is best. I am not a breast is best person. I am a fed is best person. And so no judgment for anybody. It's tough. And I almost gave up probably 100 times. But luckily I do have milk coming in on both sides. Also was a little stressed out because I've talked about it before, but I don't like the feeling of things on my chest. Even like my bra, when it touches my nipple area, I don't like the feeling. Never have, never will. Just don't like it ever since my surgery. And so I was really concerned about having her mouth on my nipple. Painful, very painful at the beginning, but I think that was just the normal part. But now it's fine. And so I feel like I've conquered that battle as well, and everything's going okay. But I think that's really it. I just wanted to pop on here and share all of that with you, but I'll need to post a picture of her too, because she's just an angel, and obviously all of that pain and everything was worth it. So and I would do it again for her in a second. She's just amazing. So I'll probably cry talking about it, but so yeah, I should stop. But anyways, that's it, and I'm gonna go. But again, thank you from the bottom of my heart of everybody that has sent me messages. And it really, I've cried several times over them. The things that you guys say to me, you're right, you're not alone. And I'm so glad that a light has been shed on pectus excavatum, and that people are more educated, and it's more well known, and the treatment's getting better, and more doctors are aware, and people are catching it sooner, and it just makes me so happy. And so that's it. But anyways, I will maybe talk to you at some point later. I don't know when I will update again. Hopefully it's not the last time I see you, but take care, and I love you all.